Hi, I'm Rick Bennett, President of Hopkins Bayview Medical Center. As you know, at our hospital we care for people of all ages and backgrounds, and many of them have very complex medical problems. To ensure that we provide the safest care and best service to every patient, we need to communicate well with each other. Our patients expect us to know about them and their care needs. So today we will highlight ways that we've improved our ability to communicate with one another, not only so that we can take better care of our patients, but also to make our daily work easier.
We know that medical errors can occur when a care team does not communicate well with each other or are not mindful and present. We've brought the Institute for Healthcare Excellence's Communication in Healthcare program to our healthcare providers at the medical center. In the off-site training, our providers learn to be present, practice reflective listening, and negotiate priorities so that our patients feel understood and respected.
Every patient has a story. In order to hear that story, it's important for me to listen without interrupting. One of the skills taught in the Communication in Healthcare course is PEARLS, which has taught me how to respond to patients' emotions with partnership, empathy, apology acknowledgement, respect, legitimization, and support.
Another way we teach staff and faculty to be present is through mindful communication. The idea is to let go of where you were a moment ago and where you have to be so you can focus all of your attention on the conversation you're about to have. Then you listen with openness and curiosity and without judgment. And this provides a greater opportunity to respond in a thoughtful way.
Mindful communication techniques help me to focus on each conversation I have and give it my full attention. Something as simple as taking a few cleansing breaths before a new interaction can have a huge impact on quieting my thoughts, listening without judgment, and truly responding to what I hear the other person saying. I think that both my coworkers and patients can tell when I practice mindful communication, and they feel like I truly care about what they're telling me in that moment.
Connect, Partner, Reflect serves as a framework for interacting with patients, families, and each other. While incorporating the skills you learned in Language of Caring, Connect, Partner, Reflect simplifies the approach of communicating in a caring and effective way. Employees can sign up for a brief training in My Learning.
All conversations have a beginning, middle, and end. Connect is the beginning of a conversation, when you create that person-to-person connection. Partner is the middle of a conversation when you listen, understand, and engage. Reflect is the end of a conversation when you check for understanding and discuss next steps.
In closing, I want to thank each of you for your work in taking care of our patients safely and compassionately. Thank you also for your help in supporting all of our new ways to communicate at Johns Hopkins Bayview so that we reach our goal of being the hospital of choice for every patient who comes to us for care. And finally, remember that you can always communicate directly with Johns Hopkins Medicine leaders about any patient safety issue or other concern by using our Speak to Us hotline. Never underestimate the power of speaking up.